happy and again privileged to help out with this virtual HIV event. I will let Dr. LaShonda Wallace, Director of So Speak, if she wants to, briefly.
Hi, I just want to thank you for being here with us for our second webinar for the series for our virtual annual Think Red ILM. I'm happy that you're here, and I'm so excited, and I'm looking forward to great outcomes in the event that, you know, we have to replicate this again, but prayerfully not, especially related to COVID. And I am going to pass the mic to Jeff Mills.
Unmuting myself. Hi all, my name is Jeff Mills. I like to call myself one of LaShonda's seedlings. So I've volunteered with Seeds of Healing for all of the Think Red ILM events also. I'm an advocate for PrEP and for long-term survivorship. I'm a volunteer in the Sage Wilmington steering committee, which is an arm of Sage USA, a program of the Frank Harr Foundation locally here in Wilmington, and the organizer of our peer-to-peer group, Heroes for Long-Term Survivors. Thank you.
Thank you, Jeff.
I see Mindy has joined us.
Hey everybody, my name is Mindy. I am a member of Seeds of Healing, member of the board of directors, and I was a registered nurse with the HIV care team for 8 years, nurse a couple years prior to that, oncology and pulmonary, and then now I am a stay-at-home mom of 2 little boys. So love kind of keeping up with everything related to HIV and helping out.
Okay.
Destiny is here with us today.
Hi, my name is Destiny. I've been volunteering with Seeds of Healing since December 2019. I'm super passionate about all of the work that this organization is doing, and I'm really glad that I can be participating in this event.
All right, thank you all so much. And I would like to take the time to thank our sponsors, supporters, and donors. And I don't know if we have anybody on the line from our, sponsors and supporters and so forth. But I'll pause and make sure that you all can speak up if you have a few remarks or would like to introduce yourselves. So, our gold sponsor is Gilead Sciences. It is a biopharmaceutical company that discovers, develops, and commercializes innovative therapeutics in areas of unmet medical need. The company's mission is to advance the care of patients suffering from life-threatening diseases worldwide. Is there anybody on from Gilead?
I don't see anybody on from Gilead. Thank you, Albert. Beth Erlin is on the line, and she's actually the chair of the board. It might be opportune if Beth wanted to say hello.
Hi, everyone. My name is Beth Ireland. I am the chair of Seeds of Healing, and like my counterparts, interested in HIV for more personal reasons. I lost my brother to HIV after more than 25 years of being positive. So I am doing this for us and hope to reduce the stigma that's associated with HIV in the community.
Thank you, Beth.
And then we have Jeffrey Long. Jeffrey Long, we can't hear you. Did you want to introduce yourself?
Okay, I unmuted. Hi, I'm Jeffrey Long. I just now joined in because I'm at the house, and usually my internet doesn't support Zoom or messenger calls type thing. But I'm Jeffrey Long. I'm in Cherokee, North Carolina. I do a lot of advocacy work with NCAN, as of now, Seeds of Healing, and I work with WinCap out of Asheville. I'm the Community Advisory Board co-chairman, and I will be doing a presentation on Medicaid expansion later on next week.
We hope it goes well, Jeff.
Thank you. Me too. I'm nervous.
It's an important issue. So, am I able to move on to our bronze sponsors?
We do have a Cressy Stokes. She's joining us through Facebook. She's not here to introduce herself on the live stream for Zoom, but I do want everyone to know that she's one of our board members, and she is a person living with HIV, and she also will be on the advocacy panel on July 28th. And I think that is it. Thank you.
For joining, Cressy. Yeah, absolutely. Moving on to our bronze sponsors. Our bronze sponsors for this event are Tri-Coast Insulation and Wilmington Health. Now, Tri-Coast, which specializes in mechanical insulation, is a highly experienced supplier of cost-effective insulation services to clients in North Carolina, South Carolina, and Virginia, and we're very happy to have them as a bronze sponsor, along with Wilmington Health. Since 1971, Wilmington Health has been committed to the care and health of our community in Wilmington, North Carolina, as well as all of southeastern North Carolina region. Wilmington Health is a physician-owned primary care and specialty care medical practice. In this way, Wilmington Health is able to provide a comprehensive and coordinated approach to the care of all of our patients. And the 2020 sponsors for this event are Trevor Yates of Edward Jones and ViiV Healthcare. Are either of them on the call today? Any members from ViiV or? Okay, so going forward with that, Trevor Yates is an Edward Jones financial advisor, and he believes it's important to invest his time to understand what you're working toward before you invest your money. ViiV Healthcare was established to take a fresh approach to the challenge of HIV, and they set themselves one mission to leave no person living with HIV behind, and we're very happy to have them as our supporters. Our 2020 donors for this event are Costco and Islands Fresh Mex Grill. We're very happy to have their support in this. And moving on to our vendors for this event, the North Carolina AIDS Action Network. And I believe we have a couple of, do we have anybody on the call from NCAN?
I don't see anyone this evening.
Okay, my apologies then. So, and also another vendor of ours is Planned Parenthood of Wilmington, North Carolina, represented by Catherine Kirby. Thank you so much for your support. She is not on the line, is that correct?
She is not.
Okay. And finally, Thaddeus Karen, insurance broker. Thank you to all of our vendors. And just a reminder of the event logistics. Each of the online events will be accessible through Zoom, and the code for the event will be sent to registrants' email that they can access via the SO website on the Virtual HIV/AIDS Run Walk 2020 drop-down events tab. Again, Dr. Wallace mentioned that we have our final webinar series on the 28th at 6:30 with an HIV advocacy panel with Cressy Stokes, Jeffrey Long, and Jeff Mills. We're very excited for that. And August 1st through the 3rd is our virtual 5K run or 1 mile walk. And registration for that is accessible through Facebook, the Seeds of Healing website, as well as directly on Eventbrite. Is a $25 registration fee that includes real-time access to the webinars and presenters, as well as an event t-shirt, race bag, and eligibility to win prizes. It sounds really fun. And there will be a raffle at the end of this and other webinars for all attendees. And also one race winner with the quickest time for both the run and walk will be eligible to win a prize, as well as registrants who attended all of the webinars. So lots of opportunities to win cool stuff. And all of the prizes were kindly donated by Trevor Yates and Edward Jones. We're very thankful for that. So, since we are doing this virtually, participants must download the Map My Walk app from Google Play Store or the Apple App Store. And you need to add Seeds of Healing and Think Red ILM as a friend. And when you log your run or walk at any time between the 1st and the 3rd, you can share it on our Facebook event page. So, oh, also, this is notable. You must be a friend with us in the app to have access to, for us to have access to your confirmed time. So with all of that logistical stuff out of the way, I'd like to move on to introducing the man of the hour, literally, Mackie King. Dr. King studied biochemistry at the College of Charleston and graduated pharmacy school from the Medical University of South Carolina. He completed 2 years of postgraduate residency training at the University of Colorado Hospital in Denver, Colorado. He has worked in internal medicine clinic and HIV clinic for the past 8 years, where he helps to manage patients' chronic conditions like diabetes, high blood pressure, hepatitis C, HIV, and more. He is a board-certified pharmacotherapy specialist and recognized by the American Academy of HIV Medicine as a pharmacy specialist. So, Dr. Mackie King, if you would like to take it away.
Thanks, Albert. I appreciate that. Can you guys hear me okay? All right, I think we're going to start off with a poll to get kind of things started and to gauge where we are before I start talking. So I think LaShonda is going to shoot those poll options up for y'all. So question number 1 is, if I want to get pregnant, can I continue to take PrEP? So yes or no? Well, that's what I see. Hopefully that's what everybody else sees. LaShonda, I think you're throwing the last poll question up there.
Oh, instead of the first one. Okay.
It's all right.
There you go. I got it.
We're all
up
learning
together. Go ahead.
Here we go. Okay. So the PrEP 101 pre-poll. So PrEP stands for pre-exposure prophylaxis. True or false? Question number 2 is, PrEP is a daily medicine that can be used to treat what? Gonorrhea and chlamydia, pregnancy, can be used to treat HIV, syphilis, or all of the above. And then question number 3 is, there is an FDA approved vaccine to prevent HIV, true or false? So if you could answer those 3 questions, and then LaShonda will pop the answers up there on the screen. And we're going to go through all of these before the end of the presentation. All right, so let's see what we got. PrEP stands for pre-exposure prophylaxis. We got almost 100% on that one. PrEP is a daily medicine to treat HIV. That's 100% correct. And then everybody's up to date with their vaccine information regarding HIV. That's correct. So there is not an FDA-approved vaccine to prevent HIV. So because of that, we got to take whatever steps that we possibly can to try and prevent it. And PrEP is one of those methods that we're about to talk about. So yes, true, PrEP stands for pre-exposure prophylaxis. Everybody got this one correct as well. So PrEP is a daily medicine that can be used to prevent HIV. That's A. And then false, there is not an FDA-approved vaccine to prevent HIV. Okay, so you guys were all correct. So PrEP stands for pre-exposure prophylaxis. So pre means before, exposure basically means to come in contact, and then prophylaxis is to try to prevent. So this is to try to prevent you from getting HIV if you were to come in contact with it. So PrEP is a once daily medication, and this is one of the most important things about PrEP is taking it every single day. So it's used to reduce your chance of getting HIV. So as a result of that, it's very important that you have to be HIV negative. effective in order to start PrEP. So is anybody perhaps wondering, well, how effective is it? So when we look at all of the information of when PrEP was studied, we found that it was about 90% effective if it is present in the blood. So you might be asking yourself, what exactly does that mean? What is present in the blood? Basically, that was kind of a measure of if patients actually took their medicine, then it should be enough to be in the blood. So if you took your medicine, it was about 90% effective. And if you were in the study where they evaluated it for people who injected drugs, because that's also a very common way that one could get HIV, it was about 75% effective. Now, I talked about taking it every single day and how that's important. You know, when they looked at the people who took the pill for PrEP every single day, 7 days a week, the medicine was 99% effective at preventing the person from getting HIV. So if you ask yourself out there, what other medicines that we know are 99% effective? There are very little. You know, we prescribe a lot of medications to different people, and very little medicines are 99% effective at doing their job. So this is one of those things where if you take it every single day, you are almost guaranteed that you're not going to get HIV from this if the risk factor is through sexual intercourse, and up to about 75% effective for those who inject drugs. Now, as we talked about in the beginning, and as everybody appropriately identified, you know, PrEP does not protect against any other sexually transmitted infections like syphilis, gonorrhea. You know, only condoms do this. So an important part of PrEP is always encouraging to still use condoms, because this does not affect any other type of sexually transmitted infections. And we think about PrEP as one of the many strategies out there to try to help end the HIV epidemic. Because we don't have a vaccine out there, you know, the FDA, or we haven't come up with one of those yet, this is one of the things to prevent it. So this is kind of one of the tools that we need to try to get the word out about and encourage more people to use. Okay, the next slide, please. So who should take PrEP? Got another question here. So this one might not be up there, but the question is, who should take PrEP? And A is everyone, B is everyone who does not have HIV, C is only men, and D is a little more complicated than a multiple choice question can answer. So if I was a betting person, I'd probably say the answer is probably D there. So a little bit more complicated than this multiple choice question can answer. So let's go to the next slide and dive into that a little bit more. So these are the three main categories of people who should take PrEP. So if you are a gay or bisexual man and you have one of the following: if you have an HIV positive partner, if you have multiple partners, your partner has multiple partners, and then if your partner's HIV status is unknown and have anal sex without a condom or recently had a sexually transmitted infection, these are indications that you could be a really good candidate for taking PrEP every day. If you are a heterosexual person, you may be a candidate for taking PrEP if you, again, have an HIV positive partner, if you have multiple partners or a partner with multiple partners. That's the same information that we talked about in the first one. And then the second one is if your partner's HIV status is unknown and you don't always use a condom for sex, and if you have sex with people who inject drugs, because remember, that's another risk factor for potentially getting HIVs through that blood transmission. And then for those who don't always use a condom for sex, who may, with men who may be bisexual, that's another indication of where you could get it. And then the third person who might be a really good candidate is if you are somebody who does inject drugs, particularly as if you're sharing needles, if you may share a needle with somebody who has HIV, and that's a very easy way to potentially then get HIV. So the question comes, you know, we have those three categories of people. So what does that really look like? There was a survey, a national survey that was put out a couple of years ago. And based on the results of that survey, they found that about 1.2 million people, and this is just in the United States, about 1.2 million people in the US are at a high risk for HIV. And these are people who could benefit from comprehensive HIV prevention. And one of those is including taking PrEP daily. So remember, 1.2 million people should be on it. So let's see how many people are actually on it. Based on the last information that we have, which is about from 2018, thankfully PrEP use is increasing, but it's still woefully underrepresented. So last numbers were about 131,000 people in the US were using PrEP regularly. I've seen some more recent numbers that are just on the other side of 200,000, but still, when you consider 1.2 million people should be on PrEP and only 200,000 are actually getting it, that kind of shows we have a lot of room to take in this step towards ending the HIV epidemic. And the most important thing for all of us here, particularly located in the Southeast region, is that the South is where more than half of all new HIV diagnoses occur. So this is of 2016, and I think that this still holds true today. Most people who are in the practice would agree with that. Even though this is where more than half of all the new HIV diagnoses occur, yet this is less than 30% of all PrEP users in this area. So we need to get this number up substantially if we hope to try to reduce the transmission of HIV. And if you look at North Carolina in particular, we're kind of in the medium high range there about the number of new HIV cases per year. And if you look at who is actually getting PrEP, it is way more men than women. So if you look for every new case of HIV diagnosis in men, there were 6 male people were using PrEP. And if you look for every new diagnosis of HIV in women, there were only 2 females were using PrEP at the time. So 94% of all PrEP users in the US are men, and only 6% of those are women. So we have substantial room for growth with trying to hit the demographics of increasing PrEP use in women as well. So if PrEP is so great, this is a poll question. Why don't more people use it? So A is it costs too much. B is because of the stigma associated with taking PrEP on a daily basis. C is the fear of side effects. And then D is all of the above and more. So everybody got this one right. So this is correct. D, all of the above and more. And we're going to talk about what some of those reasons can be. So here are just some of the couple answers that are readily available of why more people don't use PrEP. So one of the biggest reasons is that you just don't really fully understand their risks. You know, the overwhelming majority of new cases are in young people. And I think young people just don't truly understand the inherent risk that there may be with having multiple sexual partners. And even, you know, they think even if I don't have HIV, then they have very little concerns, not fully grasping the true risk that there may be. There's some warranted and valid concerns about the long-term side effects of taking a medicine every day, as I think everybody should really think about whenever you have to take any medicine. Concerns about taking a medicine every day. You know, for those of you who are on medicines now, it can be very hard to remember to take them every day, and that's a very hard concern. It's something that we try to deal with on a daily basis. One of the biggest reasons that I come into contact with is access to medication. So, you know, these medications are expensive, and if you don't have insurance, it can be a little challenging to get. So we're going to talk about some methods that we can use to help fight that towards the end of the presentation. As we know, not everybody trusts the medical community, and that includes kind of the prescribing of medications, the decisions going along with that. So there are some long-held beliefs and some mistrust about the medical community. So we need to do a better job of making sure that we help educate the patient population and making everybody feel more comfortable. And there's a lot of personal reasons that go along with that. The stigma of taking PrEP, if you're too busy, if you have a lifestyle that is just very hard to take a medicine every single day, if you can't see your doctor every day, if you have transportation, there's a host of other reasons that go into why more people don't use PrEP. And as you'll see on the next slide, some people just don't know about PrEP. But does this right here look familiar to you? So I don't have cable TV. I watch pretty much Hulu and Netflix and all that kind of stuff. And I swear I see those commercials at least 7 times in about the hour that I may watch TV a single day. So they're seeing a whole lot more commercials now for PrEP, which is a really great thing, I think, because hopefully that'll help get the word out a little bit more. So hopefully about patients being unaware of PrEP and what it is, that will continue to decrease as we see more advertisement. And hopefully we can count on you guys as being advocates on our side to also help get the word out about PrEP. So let's talk about the meds and what exactly is PrEP. You know, I was talking to my wife about this presentation today, and she was like, oh, I thought the medicine was PrEP. So PrEP is just the term that kind of stands for these 2 medicines, but you can kind of use it interchangeably and it makes just as much sense. So the 2 medicines that we use generally are Truvada and Descovy. So Truvada is the first medicine that we had for PrEP that was really widely used. And Descovy is a little bit newer. It's kind of the newer version of Truvada that was created. So the side effects can be pretty similar, and they're pretty mild side effects for the most part. Some of the most common things that you may experience is nausea, a little bit of gas, maybe a rash or a headache. But I can tell you that I personally have not given Truvada or Descovy for PrEP and had somebody want to discontinue it because of the side effects. So in general, it's extremely well tolerated, and most people don't have a whole lot of effects from that. Now, you know, there are long-term concerns for you to consider, because if you have patients or people that you know who go to Dr. Google and start looking at these medicines, you might hear some stuff. Not to mention when you hear that commercial on TV, there's always that 7 seconds at the end where they fit in 1,000 words and you have no idea what they're saying. But it's important that we educate everybody on what those side effects could be. So the thing that they're talking about really fast there at the end is related to bone health and kidney health. So that is primarily related to Truvada, and that's kind of why they created Descovy, was to try to get past some of those side effects that we were seeing in Truvada. But there is some data out there that says Truvada may affect your bone health and it may affect your kidney health. So for some people, this may not be the best option to use. Descovy could be a better option. But this is also a super important reason why it's to see your doctor regularly. So we still use Truvada, and there's still good reasons to use Truvada. We just follow your kidneys, and we make sure that your kidneys are doing well. And if we have any reason to think that maybe your bones aren't doing quite as well as they used to, we might recommend calcium, vitamin D. And then if we start to see signs that maybe they're not quite as healthy as we want them to be, then we would switch you. So, those are kind of the long-term things that you might read about on the internet, but as long as you work closely hand in hand with your provider, hopefully those can be monitored very closely and we can prevent any of those from actually happening. The interesting thing to know about Descovy, because we've been talking a lot about trying to increase the use in women. Remember, 94% of PrEP users are men, so we need to get this in the hands of a lot more women. For some reason, when they did the Descovy trials, they did not study this in a population of women who were assigned women at the woman at birth. So, it's something just to note that technically this does not have the indication of PrEP for use in women. Now, I think if you talk with your provider, many providers may still feel comfortable about using it off-label, but that's really a discussion that you have to have with your provider. So something that I always think is important to talk about is how long does it take to work? So it's the same kind of question with birth control or antibiotics or anything that we're taking, like how long does this take to work? So the exact time that is needed for full protection is a little unknown. But what we do know is how long it takes to get to maximum concentration in certain tissues. So that can be helpful. We know that it takes about 20 days to get maximum concentration in your blood and in the vaginal tissues. And we know that maximum concentration in rectal tissues takes about 7 days. So you can try to apply that information to your own personal case and see what would be best for you. Generally, we try to recommend at least 1, but 3 weeks for full protection for any given person. So in the meantime, we would encourage the use of condoms as well. So what is it like? If I'm going to decide that I want to take PrEP every single day, what should I expect? And what's a reasonable expectation from my providers? Well, so first we're going to confirm that you're HIV negative before we start PrEP, and we're just going to test you for HIV. We're going to probably draw blood to check your kidneys to see if you're a better candidate for the Truvada or the Descovy, and then we'll write you the prescription. From there, it's pretty easy. You know, we do a lot of education about making sure you take it every day and a lot of the things that we've already talked about here. From that point on, kind of the standard of care for PrEP, which sometimes can be a barrier, is that we really try to see you every 3 months. And the reason that we want to see you every 3 months is we want to get an HIV test to continue to confirm that you are HIV negative. You know, there's a lot of, that we'll talk about a little bit later, but we really don't want to continue to give you just Descovy or Truvada, which is 2 medicines in one. We don't want to give you those medicines if you have a diagnosis of HIV, because those 2 medicines alone are not strong enough to fight off HIV by themselves. So it's very important to make sure that we don't continue to give this medicine if you could potentially have HIV. If you're female, then we'll look for pregnancy tests every 3 months as well. Now, in the meantime, from here on out, there's certain screenings that will kind of vary. For a lot of my patients, we have a very frank discussion about kind of what your sexual activity is. Have you had new partners, multiple partners? And from there, we'll kind of come up with a strategy together about how often we need to check you for other sexually transmitted infections, like syphilis, gonorrhea, chlamydia, those type of things. We give refills for PrEP generally about every 3 months to try to encourage you to come back and get your HIV test. And then, you know, once a year or so, like I said, we'll also check your kidneys to make sure that all signs are healthy from here. An important checkpoint is to always ask you how you're doing. Are you having any side effects? Are you feeling okay? Or remembering to take it every day? Are there any strategies we can come up with to try to improve that? So you might be asking yourself, like, I feel like I've heard of PrEP, but I also know that there's something about hepatitis. I don't know exactly what that is. So I think this is an important thing to talk about as well. So sexually active adults, especially men who have sex with men, and people who inject IV drugs are at a higher risk of getting hepatitis B and hepatitis C. So there is a vaccination against hepatitis B, which is fantastic. There's not one against hepatitis C yet, but it's now we can treat it really readily, which is great. So why this is important is because the medicines for PrEP can also treat hepatitis B. They're really good at treating it. So if you stop PrEP and you have hepatitis B or you have had hepatitis B, we generally want to follow you for a little while to make sure that this hepatitis B doesn't reactivate. You know, overall, there's a very low risk of this happening, but it's just kind of a safety measure where we'll look at your liver, make sure it's looking good still. We may check a hepatitis B level just to make sure everything is still looking good. If you have chronic active Hep B, like I said, we might follow those levels and just check your liver to make sure nothing bounces up. There's a very low risk of this, but just kind of something to be aware of. If you are out there and you're looking to start PrEP and you have hepatitis B, just have the discussion with that provider. But it does not mean that you can't have hepatitis B. I mean, that you can't be prescribed PrEP if you have hepatitis B. So here is that first question. That is now the last question. If I want to get pregnant, can I continue to take PrEP? So A is yes, B is no, C is you're annoying me. Stop asking so many questions. Let's see what those results look like. All right, I'm gonna go ahead, there we go. Oh, so this is a good one. So it's split pretty closely. So 7 out of 10 people say yes and 3 out of 10 people say no. I appreciate you guys not all telling me to stop asking questions. That makes me feel a little bit better. So on the next slide, we're going to talk about what exactly is the question about pregnancy or breastfeeding. So what we know is that if you are a woman trying to become pregnant or thinking about getting pregnant, or you are pregnant, and if you have a partner with HIV and their viral load is undetectable, that's really good. That's a very low risk of getting that HIV. But if their viral load is not suppressed, then that is a potential risk factor for you getting HIV that could potentially go on to the baby. So PrEP can be used before birth and during pregnancy to reduce the risk of getting HIV. So when we look at Descovy or Truvada specifically for PrEP, there's not a whole lot of information about using it as PrEP for women who are pregnant or who want to become pregnant. But thankfully, Descovy and Truvada plus a third medicine is very commonly used as a regimen to treat HIV. And because of that, we have a whole lot of data that says in women who have HIV who want to get pregnant, this medicine is very safe. So we can kind of extrapolate that onto PrEP that says, you know, if you have an HIV positive partner, their viral load is not suppressed, PrEP might be a really good idea for you to try to lower that risk, and we believe that it's safe based on its use for women who do have HIV and who are taking it. In regards to breastfeeding, it's likely considered safe. There's a lot of information that says it's okay, but it's just worth having that discussion with your provider. So, you know, we talked about starting PrEP and hopefully taking it. Realistically, we know that sometimes people might forget their medicines, or they may not be able to get it from the pharmacy because if you don't have insurance, sometimes these gaps in care occur. So it's very important to know kind of what the signs of new HIV infection could be so that you could discuss with your provider and make sure that you get an HIV test. So kind of the classic symptoms are really what we consider flu-like symptoms. Now, you know, don't go out there and worry. Sometimes you might just have the flu, and that's okay. But if you have any reason to think that if you have multiple sexual partners, if you use IV drugs, if you have any kind of the risk factors that we talked about earlier, then it might be worth going the extra step to getting an HIV test for you. So those signs, like the flu-like symptoms, are kind of feeling tired, having muscle aches, again, the skin rash that we talked about, the headaches, particularly sore throat, or if you have some swelling kind of in your glands right around here, night sweats or diarrhea. So these are some of the kind of the flu-like symptoms that could be a sign of HIV infection. So what do? You go get tested. Again, remember that taking PrEP by itself will not adequately treat HIV, and it could lead to more problems down the road if you were to do that. You know, we've had some patients in the past who were maybe newly diagnosed with HIV, who were on PrEP. They may have had some gaps in care, and they were diagnosed with HIV, but they really didn't want to talk to the provider about it because they were kind of bummed out about it. They were disappointed that they lost this gap in medicine. And what they did is they continued to take the medicine for PrEP, and that means that it sometimes can be a lot harder for us to use it to help treat your HIV. So what we really want to do is, if you have any thoughts that you could potentially have HIV, just go out and get tested. So one of the most important things is, well, how do I get PrEP? We talked a lot about how this can be difficult. So the good thing is that it's covered under most insurances. So Medicaid, Medicare, and private insurances in general do a pretty good job of covering this medication. And if not, there might be some of the programs below that we talked about. So a lot of times you might be able to get assistance from the drug company. So particularly if you do have insurance, you can get a coupon card. So if you have insurance and your insurance company wants to charge you about $100, well, coupon cards out there are readily available that will help bring that price down. Now, if you don't have any insurance, then you might be a good candidate for something called medication assistance. So for brand name medicines, drug companies realize that they got a really good thing here, and they do have some very good, positive, strong motives about wanting to help the community. So in general, with brand name medications, they have these medication assistance programs where you can fill out an application, and it is generally income-based, where you can show kind of what your income is, that you don't have insurance, and you might be able to get this medication for free for up to a year. After a year, you renew the application, you might be able to continue to get it. So those medication assistance programs are readily available for many medications, including Descovy. And then there's also this website called getyourprep.com. So this is a new program that started last year from the U.S. Department of Health and Human Services. And their goal is to provide PrEP medication to people without insurance. So they, again, kind of have a whole enrollment program, and they've partnered with several big chain pharmacies like Walgreens and CVS, and they'll work with them to try to help you to get this medicine for free, because we recognize the importance of trying to slow and prevent the HIV epidemic from continuing. Now, one of the hard things about that is, while you may be able to get the medicines for free, you might have caught on, if I'm asking you to see me every 3 months, we're getting labs every 3 months, there's costs for those as well. So those can be challenging. You know, there are some health departments in certain areas that also have the capacity to provide PrEP services. So it's always worth reaching out to your local health department to see if they can provide them. For us, our personal clinic process for the uninsured is that we can help patients apply for medication assistance, and that will lead to you getting the medicine for free from the manufacturer. And then our next step is to apply for financial aid with the hospital. So the way that that helps you is because then you're not going to get charged for your labs that go along with having to monitor this medication closely. And then you'll have visits with myself or another pharmacist to continue to monitor it. And that kind of saves you the expensive copay as well. So what's coming down the road? So there's a lot of good information out there, hopefully, about continuing to make progress in preventing HIV through PrEP. So they have a long-term injectable medication that used for pre-exposure prophylaxis. And currently it's being studied to be given every 8 weeks. So that's pretty convenient. You know, a shot every 2 months to try to help prevent HIV could be really promising. We're expecting a generic version of Truvada. So generally when there's just one generic medicine on the market, the cost doesn't come down too soon, but hopefully if we're aggressive, we might be able to get that affordable for patients without insurance. And then, you know, they're continuing to explore other options. They're looking at patches and all kind of other things that could be used in the future as well. So, you know, I hope that we've had a little bit of time to kind of talk about PrEP. I know I've thrown a ton of information out there. I appreciate you being patient and answering all of my poll questions. And I'd be really happy to kind of take any questions that you may have that I didn't talk about during the presentation. Anything I can answer for anybody.
If there's any questions, you can put them in the chat box, or if you want to unmute yourself to ask a question or give a remark, feel welcome.
If I could ask Mackie, please, about kidney damage, is that likely to show up maybe even after discontinuing PrEP, or is it reversible once it occurs?
That's a really good question, Jeff. So, you know, in fact, Chris and LaShonda and myself were discussing this today. The line from the drug company and all the information says that the kidney function is reversible. So if you stop taking Truvada or if you switch to something else, then your kidney should pick back up again. What's also could be difficult is how long are you on Truvada? What else has happened during that period of time? Like, for example, if you also have uncontrolled blood pressure, and that has contributed to your kidney function declining a little bit, then if we pull the Truvada away, it could potentially be because of your blood pressure, why your kidneys don't quite bounce back as good as they used to. But the line from the drug company is that, yes, once you take the medicine away, then your kidneys should kind of return back to the function that they were. LaShonda, do you want to add anything else or your personal take to that?
No, I'm good. Take it away. Mackie's information is on the screen so that if you want to get in contact with him, you can call, ask questions. If you need more information about access at New Hanover Regional Medical Center, he can answer those questions for you as well. I'll take a moment just to assure that there are no more questions in chat. And then after that, we're going to make sure that we know who's all on the call so that we can actually do a raffle.
I'll just say one last thing. You know, we have such amazing advocates out there, and I just want to say thank you to all of you who help get the word out, who help provide education, who participate in events like these. I think it's amazing, and we could not do this without you. And I would just continue to ask you to, as a part of the discussions you're having out there in the community, what you're talking about with your friends in your social group, just to keep PrEP in that conversation as well. Because, like I said, we have hardly anything that is 99% effective out there. So, we gotta get more people knowing about PrEP and understanding PrEP in order to really make a good impact. So I thank you guys for what you do.
All right, so if there are no more questions, here we go. So we're gonna spin the wheel. I'm doing it over here, and I'll tell you in a moment. Our winner is Destiny. Destiny,
Oh, thank
you're
you.
the winner. All right. Albert, you can take it away.
Ooh, I almost unmuted myself, or I almost kept myself muted. Oh, that's a Zoom rookie mistake. Thank you so much, Dr. Mackie. That was very informative, and we all learned a lot. I can speak for everybody. I feel confident in speaking for everybody that we've learned a lot. Thank you. And thank you to our sponsors. Again, our gold sponsor, Gilead, our bronze sponsors, Tri-Coast and Wilmington Health. And also to our supporters, Trevor Yates of Edward Jones, Vive Healthcare, as well as our donors, Costco, Islands, and Islands Fresh Mex Grill, as well as our donors, NC AIDS Action Network, Planned Parenthood of Wilmington, North Carolina, and Thaddeus Karen Insurance Broker. So we're going to be going over the event logistics again. Thank you, slide. Each of the online events, again, accessible through Zoom. You're going to be getting the code sent through your email if you're registered. And you can access via the SO website on the Virtual HIV/AIDS Run Walk 2020 drop-down events tab. Our last webinar is next Tuesday, if I'm right about that, July 28th at 6:30 with the HIV advocacy panel with Cressy Stokes, Jeffrey Long, and Jeff Mills. We all appreciate their time, and we really look forward to seeing you all there. And then August 1st through the 3rd is the actual 5K run or 1 mile walk, where you can register for that through the Facebook or through the Seeds of Healing Facebook or the website or directly on Eventbrite. It only costs $25 and includes real-time access to the webinars like the one that we just sat through. And you also get a t-shirt, race bag, and eligibility to win prizes. And there will be raffles at the end of each webinar for the attendees, for the race winner for the quickest time, for both the run and walk, and for registrants who attended all of the webinars. And again, you have to make an account with Map My Walk. You can get that through the Google Play Store or Apple App Store, and you have to add Seeds of Healing and add Seeds of Healing Inc. Think Red ILM as a friend, and you have to log your run or walk time anywhere between those dates. Share it on the Seeds of Healing Facebook event page, and you have to be a friend with Seeds of Healing in the app for them to have access to your confirmed time. And if I could give it off to Dr. Wallace, or if there's anything else anybody needs to say. I think we had a really good time listening to Dr. Mackie. I sure learned a lot.
All right. If there's, let me just look in the chat box just to make sure
Oh, yes.
that we address. I just see I learned a lot. Thanks, everyone. It was very informative. Thank you, thank you. There are some web links that are shared. Good to see you all, and everyone stay safe. All right, if there's any part of the program that you missed, we will take the link once it is accessible, and we will share it on our social media feeds. I did get feedback that the video did stop the live feed on social media, but that's why we record it. So again, thank you for being here.
Thanks, y'all. Have a great day.
Thank you, guys.
Thank you, Mackie.
Bye. Thanks, Mackie.
Thanks, Jeff. See y'all.